So just taking that story forward a little bit in summary, over 8 years, life expectancy at birth lifted by 3 years, which was, so we'd closed in on the national rate, and we'd significantly reduced the gap around Maori and Pacific, and even the male-female gap. And the major factor there was getting people onto statins, plus some modest impacts on smoking rates. Hospitalisation had dropped to the demographic growth rate. ED attendance rate was flat. Ambulatory sensitive hospitalisation rates, which is the equivalent of your PAH rate, had reduced significantly for children. We didn't do so well for adults there. Immunisation coverage had rocketed from 60% to 89%. Access to primary care was dramatically improved. Smoking rates had dropped. Overall, the obesity growth rate had slowed, but at the high end of obesity, it had actually got worse. The good news was, in terms of the financial deficit, that had been eliminated within 2 years. How do we do that? Sounds like a miracle, but it was two things. One was freezing funding to the hospital, number one, and number two, we got more funding because our population was climbing and we were being moved to population-based funding. And subsequent to that, we ran minor surpluses.